Well, good afternoon. It is Saturday afternoon. It is 4 o'clock. By golly, it must be time for the senior moment. This is Connie Clark with Home Helpers, and I have a really neat guest with me today, and that's because this is a very wonderful, special time of the year. Haven't you noticed all those increased in commercials on the television concerning Medicare supplements and choosing your Medicare provider? Well, now it's time for you to do that. So Heather Tabor, who is with the Department of Insurance for the state of Idaho, this is her busy season. This is a time that everybody comes and asks questions and wants to know which provider. And I was able to wrangle her and get her in here today so we could talk about this. So welcome, Heather.
Thank you very much for having me, Connie.
I know this is your busy time, and I really appreciate you taking your time out to come talk to us, because a lot of people now are asking a lot of questions.
Well, I'm very glad to do it. I'm glad that we're going to be able to reach the people listening today and also reach people that they'll know with some good objective information.
I know a lot of times when it comes time to choosing your healthcare provider, they do a lot of commercials and just say how wonderful their companies are. But I've heard you talk in the past where choosing your Medicare provider is a very individual thing because, yeah, your neighbor or your friend or even your spouse might have certain medical needs, and your medical needs may be different. They may have a lot of prescriptions, you may not, that sort of thing. And so when you go to choose your provider, you really need to take into account what your individual needs are, correct?
Yes, I think it's very important that people really pay attention to not just the cost of the insurance that they are looking at buying, but also the ease of use of the policy, the convenience of the policy to them as well. Sometimes people focus in just on the name of a company or on the premium cost for a policy. And people really should take into consideration as well the name of the policy, not just the name of the company, and also the costs for services when they use services, not just the premium for the policy. I say that because companies' names are very popular for people to discuss and throw around. Somebody might say, oh, well, I use Company X and it's just the best thing in the world. But Company X probably sells a lot of different products. And so a recommendation by name of company really isn't telling somebody a whole lot about which type of policy the person recommending the company might have purchased.
Because there's different options with each policy.
Right now, we're looking at companies who are selling individual health policies. When it comes to people who use Medicare, though, most people are looking at buying Medicare supplement policies, also called Medigap policies, or they might be looking at buying prescription drug insurance, Medicare Part D policies. Or some people look at buying what's called Medicare Advantage or Medicare Part C policies. The same company might offer all those types of coverage. So if you're taking the recommendation from a friend or family member, it's very important to know exactly which policy they're recommending. And even then, you need to know how that policy would apply to your life.
Your particular healthcare needs.
Exactly. For instance, some policies might cover a certain kind of medication, but not other medications. And so it would be very important for people to check and make sure that the prescription drugs that they need are covered on a policy if they want to have prescription drug insurance.
So they can look at particular drugs to see if a policy covers that particular drug.
Yes, that's one of the services that we provide for people as well at no cost. We do have several talented Medicare counselors that work with the SHEBA program and help people look at what the best Part D prescription drug policy or Medicare Advantage policy that might include prescription drugs would be for their particular medication needs. It could be very difficult to figure that out. You'd need some kind of slide rule and abacus or something, I think, if you were just trying to poke through each different policy and scratch down the premium and the co-payments and what about this and what about that. And so Medicare.gov, which is the website for the Medicare program, puts a wonderful tool together. It's an internet-based tool that allows people to enter the names of their medications, also the dose of the medication, and the frequency that they take it. They can also enter the name of the pharmacy they like to use, and then the computer program does all the math for you and shows you which policies are least expensive for the medicines that you use.
So it's not just the medication, it's the dosage.
The dosage, some pills in different doses can be very different cost. I was working with an individual recently who was taking a very low cost $10 dose of medication, and then the medication dose was changed to a higher dosage, and the cost went up well over $200.
Wow.
So
What a big difference.
It can make quite a big difference. Pharmacy choice can make somewhat of a difference as well these days. For most people who use insurance to help them buy prescription drugs, the insurance company is setting their cost for the medication or their co-payment for the medication, not the pharmacy. So for most people who use prescription drug insurance, their cost or co-payment for their medicine is the same, no matter what pharmacy they go to. However, lately, insurance companies have been making what they call preferred pharmacy agreements. So there'll be some pharmacies that they offer lower cost sharing to people for using. Sometimes this will be a mail order pharmacy. For instance, maybe your copayment is $10 if you go to the retail pharmacy, but if you use our mail order service, we won't charge you anything.
Mine is like that, yeah.
Yeah. Or some people, it might be a different particular retail pharmacy that costs would be lower at. So if somebody has a certain pharmacy they really like to use, when they enter the name of that pharmacy into this tool on Medicare's website, they can see what their costs at that pharmacy would be.
Can they leave the pharmacy part blank and get all the pharmacy's costs?
Well, no, you do have to choose a retail pharmacy.
Oh, okay.
But you can, there is a function that allows you to look and see whether or not a preferred pharmacy would be lower cost.
Oh, okay.
So you do have to poke around in the pages a little bit to find that information, but it is there. And you can see a list of all the networked pharmacies, and if there is preferred pharmacies or not, you can see the names of them.
Okay.
So we do have quite a few prescription drug plans that are going to be available to people in Idaho this year.
And that's one of the questions. I know I've heard you talk in the past about the donut hole. Is any of that changing?
Yeah, well, the donut hole is a part of Medicare Part D coverage that insurance companies have to follow the staged coverage agreement in order to offer Medicare Part D coverage. Well, the way it used to look a couple of years ago was that a person would pay about 25% of the cost of their medicine until they'd had a certain dollar amount of medication. Then the insurance company would stop paying, and the person would have to pay 100% of their medication cost.
And that's what they call the donut hole, right?
And they called it a donut hole because there is a certain point in time, and it's money related again, how much money you've spent, that then you get out of the donut hole, and they start paying.
So coverage picks up again.
Coverage picks up again. So this coming, this current year, last year as well, the Affordable Care Act changed that structure to Medicare Part D benefits and started closing that donut hole down. This year, during 2012, if people have $2,930 worth of medication, that's when they fall into the donut hole. But when they're in the donut hole this year, they pay 50% of their name brand costs.
Not the 100 like it was.
Not the 100%. So they get a 50% discount on name brand medicine. And for generic medicine, they pay 86% of the cost. and get that 14% discount. Now, coming up in 2013, because of the Affordable Care Act, the donut hole will be even smaller. People will pay 47.5% of the name brand medicine cost, and they'll end up paying 79% of the generic. The dollar amount to get into the donut hole is a little bit higher than it was this past year, but not terribly large.
So you don't get into it as quickly.
You probably get into it almost as quickly. It's just a little bit higher. So considering the costs of medication increasing,
going up,
it's probably not going to make too much of a difference there. But the people will have a little bit more reduced costs. Now, the staged changes to this Medicare Part D coverage will keep changing what people pay in the donut hole until 2020. And then in 2020, there won't be that donut hole or that change in the level of coverage anymore. It'll just be a flat benefit where people pay 25% across the year.
And then that's it.
And that's it. Now, there are programs available to assist people who have lower incomes and resources pay for Medicare Part D premiums. And those same programs also reduce the co-payments on Medicare prescription drugs, so that people who have lower incomes and resources can have much lower costs for their prescription medicines. And those people also don't have a donut hole then as well.
So how would someone qualify for that?
The qualifications for the program called Extra Help are based on a person's income and their resources. So a person, if they were single, would have an income of no more than $1,425 a month, and they wouldn't be allowed to have more than, I think it's $13,500 in savings and investments. So those would be the resources, savings accounts and investment accounts. So if a person is running low on resources and their income falls below that amount, then they can apply for that low-income assistance.
Would they apply with
prescription drugs?
Medicare or with the Department of Insurance, or where?
We can assist people with that application. Interestingly, it's a Social Security benefit, even though it's about Medicare benefits.
Okay.
It's a Social Security program. So the program's called Extra Help from Social Security. People can go right online to Social Security's website and apply right there. It takes about 5 minutes to apply, and you get an answer in about 10 days. If you don't like to use the internet or you don't want your business out there, then you can do a paper application. There's one scanner in these United States, in Wilkes-Barre, Pennsylvania, that reads those paper applications. And it does take about 10 weeks to get an answer back if you do a paper application. So if you do know somebody who doesn't like to use the internet themselves, please have them get a hold of us at the Department of Insurance SHEBA program. We'd be happy to use the internet for them to help them get that faster response.
Okay.
People could also ask their family, their children or grandchildren or parents who might use the internet better than they do, to help them apply online at socialsecurity.gov. It is a very secure process for applying online, and you just get such a faster answer that we really encourage it.
Thank you. And I know in past years when I've heard you talk that the providers in our county has changed. Has any of that changed this year?
Sure. Well, for prescription drug insurance policies, the same standalone Part D policies are available throughout the state. There will be 32 policies that are just prescription drug policies available in Idaho this year. And the good news is that this year there's 4 options that are under $30 for premiums. Now, before people jumped all over those lower premium cost policies, they'd want to make sure that their medications were on the formulary, and that the co-payments for their medicines were the most affordable co-payments they could have, and that the pharmacies they like to use are included in that network. But that's good news that there's a choice of 4 options that are under $30. The other 28 options. Of course, they're over $30.
But you may, like you say, want to be careful because, yeah, your premium might be lower, but your copay is higher, so that might
It could.
offset.
Yeah, it could. People who don't take any medication at all or who have fairly simple or inexpensive medications often benefit from those lower cost programs. But if people take multiple inexpensive medications, or they have more expensive or medications that just aren't on that particular plan's formulary. Sometimes it's not very expensive at all, but it's still just not on that formulary. The other type of insurance that we talk about a lot this time of year is the Medicare Advantage insurance. So Medicare Advantage plans are a different type of insurance that includes health care benefits as well. And people do need to be very careful when they're looking at Medicare Advantage plans to understand that this is going to be the source of payment for their health care services as well as maybe prescription drug benefit. So people do need to make sure they understand those implications. In Kootenai County this coming year, we're going to have 20 options for Medicare Advantage plans available to people.
Are these all ones that were the same from last year, or do we have some
No,
changes?
there have been quite a few changes
Okay.
to the Medicare Advantage marketplace in Kootenai County. So there have been quite a few changes. Some of the insurance providers last year have stopped selling certain types of policies that they were selling, and it's called a non-renewal. People who are affected by that non-renewal are getting notices right now that their particular insurance policy is not going to be available any longer in 2013.
So some people may be panicking, looking in the mail going, oh my gosh, what do you mean I'm not going to be covered? You know?
Right. Well, and they will be covered. If they don't choose a different Medicare Advantage plan, they will have original Medicare benefits. So people do not lose all source of payment for health services when their Medicare Advantage plan leaves the market.
Well, I need to take a break, but I want to continue on this because I know from personal experience this gets really confusing. Even when you understand it, it's confusing. So I want to keep talking about this, but we need to take a break, so we will be right back. So how many, I'm sorry.
No, it's just like incredible. It's just it's a nightmare. I've got it down here. I've got 5,000 people, I think, who lost their Medicare Advantage plan.
Wow.
But,
And that's just Kootenai County.
And what I didn't talk about was there's probably there's probably about 5,000 people whose prescription drug plan left the market. Too.
Oh, okay. And we're just talking.
Low income people. They're probably all low income people.
And I want to point out that that's just Kootenai County, and that every county is different,
no,
right?
Yeah, no, we got 5,000 in the 5 northern. I'm sorry, we've got Kootenai County. I've got it in my notes here. 1,300 in Kootenai County lost their Medicare Advantage coverage.
Okay, and so it's 5,000 in the northern.
About 5,000, maybe a little less, 4,000 in the northern 5 for that, and then actually maybe even less than that. 5, 8. Search math. Well, anyway, 3,000 maybe.
Okay.
But then the prescription drug plans too. I don't have the numbers on how many people. So
Okay.
that's where I get the 5. Some of the prescription drug plans aren't going to be available again, and
So we can just say, well, you may see this come in the mail, and this is what it means. Okay.
Yeah, and people should probably get a hold of this. But if they do end up in January wondering what's happened to their coverage, that they should call and ask because they might still have options.
Okay. All right, you ready to get started?
Yeah, where were we? Talking about Medicare Advantage plans. I'm trying so hard not to say company names.
That's okay. And remember the gum. You ready?
Yeah, hold on.
And we're back. Again, this is Connie Clark with Home Helpers, and I've got Heather Tabor in here with me this afternoon, and we've been talking about all the changes that are happening with Medicare, because now is the busy time of the year where we're seeing all those commercials come on for all those new Medicare supplements and Advantage plans and all of that. And Heather was telling us that there are some Advantage plans that are no longer going to be offering certain packages. And during the break, you were always also saying that there's some prescription coverage that's going to change. So there's going to be people out there that when they open their mail, they're going to get a notice saying effective, January 1st, you're no longer going to have health care or...
And that will be it. It will be January 1st. That will be the date that the change happens. People need to make choices about what they want to do to replace that coverage if they are getting a non-renewal notice.
And it has nothing to do with them personally, it's what the company
Correct.
is doing.
Companies decide which insurance policies they're going to offer in which markets every year. And then people who live in those markets have the opportunity to buy them. No, it's nothing personal about them or their situation, or they had occurrences that were expensive. It was just about the fact that that insurance company has decided to do something different with their business. So
and it could be
drug,
and it could be different when you cross over the line into Washington State.
Yes, or just into Bonner County or Shoshone County. Medicare Advantage plans are county by county. The prescription drug plans that are just Part D coverage are statewide. But we, of course, living in this market, do see a lot of advertising for both states. So it is.
So you might see something on the television and you go, oh, this looks great, and you call and you can't get it.
Right, and
okay.
It's not to be taken personally, and it's not Idaho's fault. It's companies decide, and sometimes they make those decisions based on population density. And they design those packages around the population that they're serving. So we do have about somewhere around 7,300 people in Kootenai County who choose to use Medicare Advantage coverage to have their Medicare health care expenses covered. And that's about 25 to 28% of the total market. We have about 1,300 of those folks who will be getting non-renewal notices for their Medicare Advantage.
And that's just Kootenai County?
That's just Kootenai County.
Okay.
Yeah. So the people who are receiving those non-renewal notices should know that they do have a lot of options for choosing coverage when their Medicare Advantage plan pulls out of the marketplace like that. They have some guaranteed rights and protections. So they can choose to use a different Medicare Advantage plan, or they also can choose to buy what's called a Medigap policy or a Medicare supplement. And that policy, at this period in time, people who get non-renewals notices for Medicare Advantage plans, no Medigap policy could refuse them coverage or charge them more because of their health history. It's a certain special guaranteed issue right for Medigap insurance. So some folks will look at using Medigap insurance instead of Medicare Advantage, and some folks will look at the Medicare Advantage plans that are available for purchase for 2013 and choose from them.
Do we have the addition of many other products this year, or is it a wash?
Yeah, we do have some new companies coming into the marketplace this year in Kootenai County, and we do also have some new additional types of policies being sold. So Medicare Advantage plans in our county are different types. It's different styles of payment to providers and different rules for beneficiaries to follow. There's private fee-for-service plans that do have networks of providers, but also allow people to see providers who are out of network.
And I guess that's an important thing, because if you change now your insurance provider, do you need to go to your physician and make sure that they take that insurance?
Absolutely. And instead of even saying take that insurance, we really want to encourage people to check with their providers and ask them if they're in network with
that
the insurance
provider.
company.
Okay.
When you're a doctor's office or a provider of services and somebody asks you if you take that insurance, they could interpret that to mean, will you take payment from any insurance company? So from their side of it, they might very well say, yes, we'll take payment from any insurance company. We'll take money from anybody who wants to pay us.
Right.
So asking, do you take this insurance, is probably not the question we want to ask. What you want to be asking is, are you in network with this particular insurance policy. Again, not the name of the company, but this particular policy.
Because they may take different policies from that provider, but not the one
Correct.
that you're going to pick.
Yeah, they may be in network for different types of services.
Okay.
From that company. So very important to ask the provider. The insurance companies do keep lists of providers who are in network as well, but it is important to check with the provider too. The provider may have changed their insurance contract with that company, and the company might not have their records updated yet. So it's important to check both ways, cross-check that. So the private fee-for-service Medicare Advantage plans, we're not going to have very many available in Kootenai County. And the other 4 counties in our northern region here aren't going to have any available at all. So there'll be very limited options for people to use what's called private fee-for-service Medicare Advantage coverage. That coverage was kind of popular for people around here because it did allow them the choice of using in or out-of-network providers, and there weren't any authorization rules for people to follow. Another type of insurance that will have lots of options here in Kootenai County and the other counties as well in North Idaho is called PPO coverage, and that stands for Preferred Provider Organization. Again, this is about networks of providers, and with a preferred provider organization, you pay one amount for seeing an in-network provider, and then maybe you pay just a little bit more to see an out-of-network provider. And so you don't have to limit your provider choice, but you do have to understand that if you choose to use out-of-network providers, you're going to have a higher cost. PPOs also do have some authorization rules that they follow. For instance, they might require pre-authorization before you see a physical therapist, or perhaps it could be pre-authorization before a skilled nursing facility stay or a CT scan, something along those lines. So there's some rules to follow as well.
And it's important to know that if you have moved here from somewhere else, you really need to look at your insurance, because don't you have to change providers because that provider may not be here?
Yeah, you do have to live in the service area of the Part D or Medicare Advantage plan that you buy. So when you move to a new area, you do have a special enrollment period. You can change your insurance policy to make sure that you're buying a policy that is going to serve the network of providers you have available to you. So yes, very important when you're moving to also check and see what the implications to your insurance are.
Because I know, you move, you don't even think anything about it until something happens. And then you go try to use your insurance.
Very good point. And I think this is a really good point for people who are caregiving maybe for their parents or a sibling as well. Sometimes we want those people who are vulnerable or needing more medical attention to move closer to us. And it is something that should definitely be considered in the move, is what are those insurance costs or healthcare costs going to be in the area that somebody moves to, as well as how am I going to set them up with a primary care provider, and when will I need to have medications filled? Will I need to have a new prescription for medications, or will I be able to continue to use the older prescriptions? That's a really good point. We went a little bit off, but
no, but I mean,
really
it's all
good point.
related, because a lot of people don't think about their coverage until this time of year. And if they have moved since the last time they had this decision to make and never really had to do anything with their coverage, you really need to pay attention.
Yeah, a lot of people when they move, if they do update their address with Social Security, then the insurance companies get that information eventually as well. What happens is that the database with Social Security demographic information gets uploaded into the Medicare system, and the prescription drug companies, plan companies, and the Medicare Advantage companies then also download those certain bits of data, demographic information from only their customers. They don't get to look at everybody's demographic information, but they do have to look at the demographic information that's in that database for their customers. So if you do report an address change, that insurance company eventually will see that address change as well, and then they'll be responsible for letting you know that they're not allowed to offer you insurance in your new area if that's the case.
Well, if somebody, I would be totally confused trying to figure out what insurance to get and all of that. So if somebody needs help that maybe they can't get on the internet to take a look and see their drug prescriptions, or they're trying to figure out what insurance is best for my medical situation, they can talk to your folks, correct?
Exactly. That's exactly what our services are for. The Department of Insurance SHIBA program. SHIBA stands for Senior Health Insurance Benefits Advisors. You don't have to be a senior, though. It can be anybody who uses Medicare. About 25% of the population in our area that uses Medicare actually uses Medicare because they have a disability, not because they've gotten to that magic 65-year-old age. So we do help everybody, not just seniors. And every state actually has a program like this as well. The programs are called State Health Insurance Assistance Programs, or SHIP programs. Medicare, the Center for Medicare and Medicaid Services, or CMS, gives a grant to each state to make sure that this type of local and objective information is available to people. So if you do know somebody who lives in a different area, they do have a program or a service that provides one-on-one counseling about Medicare benefits everywhere in the United States. To find your local SHIBA or SHIP office, it's not called SHIBA everywhere, people can look on the back of their Medicare and You book. So right on the back of the Medicare and You book in Idaho is the Department of Insurance SHIBA program phone number. And if somebody lives in Nebraska, it'll be the Nebraska SHIP office phone number. It's also listed in the table of contents. People could also call 1-800-MEDICARE, and 1-800-MEDICARE would give them the phone number of their local SHIP office.
Now, this Medicare and You book, does it list all the different companies and the policies that are available in their county?
The Medicare and You book that people get in the mail does list Medicare health plans, and that's what the Medicare Advantage plans are. It lists all of them that are available in the state. And then some of the policies will list which counties they're available in. The prescription drug plans are all listed in there as well. But it's really not enough information in the Medicare and You book to make a decision about which policy to buy, because the Medicare and You book only gives us the premium information, might give us the copay for doctors and the copay for a few other types of services. But again, that's just not enough information to make a good, conscientious decision.
So where would you go?
You would come to the SHIBA office or call the SHIBA office, or you could use the web-based Medicare.gov site as well to compare different costs. Some people use insurance brokers or agents, they call them. Insurance producers, we say at the department. But some people will use insurance companies and insurance agents as well. And there's nothing wrong with using that. You should always understand, though, how your insurance broker or producer is getting compensated, and understand which products they represent, and whether or not there are other products available to you that particular producer is not selling, and so they're not telling you about them.
That's what I was going to say. They may not have all your options out on the table when they're talking to you.
But most insurance producers who are conscientious, if they know that there's a product available that they're not selling, they'll usually refer somebody or tell somebody, I think somebody else can help you. But there will be those people who don't have that broad knowledge of other products that are available as well, and have only learned about the products that they sell. So people should make sure that they cross-check information as well. Connie, I wanted to go back to talking about the different kinds of Medicare Advantage plans, because the last kind of Medicare Advantage plan that we didn't talk about is the HMO, or Health Maintenance Organization. And we will have a lot more HMO products available in Kootenai County this year. We've had few HMO products available in the past, and the companies that sell Medicare Advantage plans are offering a lot more HMOs to us this coming year. The important thing for people to realize about HMOs is that you must follow those insurance company rules for providers. Generally speaking, what an HMO is a way of managing healthcare costs and healthcare services. So they have a primary care provider that you see. Your current physician might be part of that HMO network already and might be the primary care provider you can see. But you would use that primary care provider as kind of a gatekeeper of medical services. So if you needed to see a cardiologist, your primary care provider would refer you.
So this is where the referrals would come from.
Correct, and authorizations. If you needed to see another kind of specialist, then your primary care provider would refer you. If you needed to have a certain kind of blood test or a certain kind of other service provided to you, that primary care provider would be authorizing it through the insurance company and making the referrals to certain providers to follow through with that. A lot of people do very well with HMO style care because it is that kind of comprehensive service that they're looking for. Some people don't do well with that.
It would be where your primary care physician would know everything that's going on with you.
True. Yes, that's the idea. The idea is that your primary care physician there is one person who knows everything that's happening in your services. Sometimes people visit several different doctors and there's not a coordination of care that's being provided, and so that's the design behind an HMO is to limit that practice and provide you with more comprehensive care from one central point. Now, some people, though, aren't happy with that type of care and would rather direct their own care and services. So those types of people should be very cautious when they join an HMO because they'll likely be pretty disgruntled.
Having to go through them.
Mm-hmm.
Okay, we need to take one more break, but we need hours and hours to talk to you because you just have so much information. So we're going to take a break, and we will be right back. Good grief, you always fill my head.
Oh, it's just too much, isn't it? Too many words. And
have you got presentations coming on about all of this?
Yep. Well, October 2nd. But I think so I'll skip the ones for next week. I have 4 next week. And then 10th, 17th. And is the 10th a Thursday? I just set one up. Let's see, 11th is a Thursday.
The 11th is Thursday.
Can't remember what time. 11. And what's the beehive called now?
Agency?
You can watch the paper, yeah. And if we have time, either talk about preventive or quality. Should come back and do something just on quality sometime.
Okay.
Quality.
We can do that.
We're getting a lot of quality complaints.
How are you? From bills or?
Just too early discharges.
Oh.
Not good.
The quality of the care. Wow.
Skilled nursing and hospital. Kootenai. I'm hearing a lot of people complain about Kootenai.
Okay.
The wrong way. We're supposed to be getting better.
Yeah, really. That's what this was for.
Mm-hmm.
Okay. You ready?
All right, where are we?
If you have questions, there's going to be presentations that you're going to be putting on here locally.
Okay. And I got some
Lots of information on the
fraud
website.
stuff, preventive stuff. Okay.
Okay. Ready?
Yep.
And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I've got Heather Tabor on here with me with the Department of Insurance for the state of Idaho. And we've been talking about all the different changes coming up with Medicare because now is the time for you to decide about your Medicare provider.
The
And-
annual enrollment period for Medicare Part D and Medicare Advantage plans, it's October 15th to December 7th. So you people who are looking to add, drop, or change their Part D prescription drug insurance or Medicare Advantage health plan need to make a decision by Pearl Harbor Day, or they might not be able to choose their own coverage for 2013.
And now is the time. Now, I know that there are other times you can change, and we were talking about when you move.
Yeah, certain special periods, but they're not usually things that you can control. People with lower incomes and resources who are eligible for assistance programs through Medicaid or through that extra help program that I was telling you about, helps pay for prescription drug expenses. Those people can make changes throughout the year as well. But other people must make a choice that's for the entire calendar year.
So if you've been thinking that you're not happy with your provider's insurance company right now, now's the time to do it. It starts on the 15th, which is coming
October
up here
15th,
shortly.
You betcha. October 15th, and the decisions must be made by December 7th. Now, if a person ends up in a situation where they joined a Medicare Advantage plan during this annual enrollment period and they find that they didn't really understand it or they made a mistake, they can disenroll from that product until Valentine's Day. But after Valentine's Day, they're stuck for the remainder of the year. And that's for Medicare Advantage coverage only.
Okay.
But unless there was we call it I think, material misrepresentation. So if an employee of the insurance company misrepresented the product that the person bought, then that person would have a valid complaint as well to disenroll or change that policy. So we do want people to know that we take fraud very seriously and in the Medicare world, and that this type of misrepresentation to entice people to buy Medicare Advantage coverage or a specific Medicare Advantage plan is not kosher. It's not kosher at all. If somebody misrepresents coverage, then that is certainly reason to come to the Department of Insurance SHEBA program and make a complaint, or call 1-800-MEDICARE and make a complaint. Or you can now, of course, go online to Medicare.gov and fill out a complaint form right online.
Well, if you're confused, and I know I am just sitting here talking to you.
Oh, nonsense.
About which direction to go, you've got some presentations coming up locally that are free that folks can come listen to and ask questions. Isn't that correct?
We do. We absolutely do. On October 10th, we'll be at the Prairie Run Senior Apartments at 2 p.m. On October 11th, we'll be at the Regency and Beehive. I guess it used to be called Beehive Assisted Living, but now it's called Regency.
They're on
Assisted
Sherman
Living.
near 90.
Mm-hmm. And we'll be there at 11 o'clock on October 11th. On October 17th at 1:30, we'll be at the Hayden Library, and they have a very large room there that will be giving some local-based information, and we have some presentations in the outlying counties too. If people are looking for that type of information, or they do just want to visit with us one-on-one, we do have a 1-800 number that they can call, 800-247-4422, and again, that number is right on the back of people's Medicare and You book as well. They call that 1-800 number. We might be able to just answer their questions simply over the phone, or we might be able to set up a one-on-one counseling appointment for them, or give them direction about where some education programs are taking place in their area.
So there's a lot of information out there. There's no reason to be confused and frustrated that you can't find an answer.
Right. Sometimes people are looking for solutions that don't exist. What we do provide for people is a broad understanding of what their options are. Unfortunately, sometimes there's not an option that really fits somebody's needs, and that's nothing that we can create for them. But at least we can help people understand and make sure that they're making educated decisions and help them plan for where they might have additional needs that they're not going to be able to meet with their own finances.
Because that's really important, because there could be a lot of money difference between coverage of what you have to pay in the coverage of one policy and what you have to pay in the coverage of another policy.
Huge differences. There can be huge differences.
And spouses do not need to have the same insurance.
Absolutely not. There's some times that people coincidentally will have the same insurance, but you really should look at it as an individual insurance decision. People do need to really evaluate their monthly expenses sometimes, depending on their budget, or some people will be evaluating their yearly expenses. And so it could be very different from person to person.
I find that very interesting that you can go online and actually see the prescription you're taking and the plans that you want and see the difference of coverage. That's really neat.
The Part D insurance plans and the Medicare Advantage plans that offer health insurance to people who use Medicare are really contracts between that insurance company and the good old federal government. So CMS contracts with these companies. These companies must follow some very strict guidance and rules about what and how their packages will look like to people. Why is that, do you suppose? Well, it's because they do get money from CMS, or they do get money from the federal government to finance these packages. People pay premiums to the company. For instance, I mentioned there's 4 policies that are available for prescription drug coverage only that are under $30. A lot of people would think, well, how does this insurance company do that for under $30? How are they going to pay for medicine for people? Well, the $30 that you're providing to the company is not the only money they're getting. They also get a subsidy from the CMS, about $55 for each person who joins a prescription drug policy. With Medicare Advantage coverage, it's around $750 for each person who joins that plan. So you can see where the built-in incentive for Medicare Advantage plans and Part D plans is to really get a lot of healthy customers on their rolls.
So that's $700 a year that they get?
No, $700 a month, about $750 a month for a Medicare Advantage customer. And then the customer themselves pays along a certain amount on a premium.
And that's for the health care?
That's for health care and usually includes prescription drug care too. Now, one of the changes in the Affordable Care Act to Medicare Advantage plans is to actually try to increase the quality of coverage provided to people through those Medicare Advantage plans. And the change was made to start reimbursing the company. They give them that monthly, they call it a capitation amount. But from now on, that amount is going to be based on their star rating or quality rating. So when people complain, that lowers their star rating. And
the insurance company.
Correct. The insurance company's star rating goes down, and they'll receive less money the following year for each person who enrolls in their plan. If they provide excellent customer service and people don't leave their plan, they'll get higher or more stars, and they'll get the upper range of that reimbursement rate from the government.
So it's important, if you're not happy with your insurance provider, now, who would you complain to, CMS?
You would call 1-800-Medicare. You can call the Sheba office. You can go online to complain at medicare.gov as well. You can use any of those resources to complain about the quality of customer service. You can complain about the payment cycle. Perhaps a payment, you did not receive reimbursement, or a certain item or test wasn't covered the way it was supposed to be. You can appeal those decisions, but you can also complain if the company is not following their own appeals process, or if they're not following their own rules that are in their evidence of coverage documents. Most of those rules are based on what Medicare or CMS says they must provide to people. I think the reason I started talking about this was part of the way they also get reimbursed is based on their costs, and so the companies must load their formulary and co-payments for medicines into this database at CMS so that all that cost information is very transparent. And that's why there's this wonderful tool on Medicare.gov that does all the math on people's prescription drug costs, because those insurance companies must upload that cost information for the various formularies.
So they're really out there trying to get your business, because you might be a healthy individual that takes no medications. You go once a year, you get your physical, and that's it. They're making lots of money off you.
Yes, and again, because of the Affordable Care Act in 2014, that money that they make off of you, 85% will have to be returned to healthcare benefits. So, in other words, they won't be able to just keep profiting for their own pockets. They have to return that into lowering your healthcare costs as well. So maybe they lower your co-payments, or maybe they provide some additional services at no cost to you. When you pay a premium to the insurance company for Medicare Advantage coverage, you should be seeing a reduction in your costs for medical services somewhere in that package. So for most people, for Part B, like boy, medical services, if they're using Original Medicare, they owe about 20 to 35% of the cost of their services. So a Medicare Advantage plan, if you're paying a premium to that company, then you should see a reduction in those Part B covered expenses that somewhere in there at least breaks even with the premiums you're paying. Another type of thing you might see in a Medicare Advantage plan that would justify paying that premium to the company would be additional services that you don't receive from Medicare Part A and Part B alone. For instance, coverage for eyeglasses, or coverage for dental exams, maybe a gym club membership. That's a very popular benefit.
Yeah, I've seen that in
people.
some of them.
Yeah. Medicare's preventive health services are at no cost to people now. So most of the preventive health services that are available through Medicare have no cost to people if they use Medicare providers who accept assignment. That's an annual health exam, but it's also other tests and services that might help a physician decide whether or not somebody has a problem before it gets out of control. Medicare did add some new preventive services to their packages this year as well. Whether you use Original Medicare or a Medicare Advantage plan, you shouldn't see a cost for those preventive health services as long as you're using a Medicare provider who accepts assignment.
And that's the important part that we were talking about. Make sure your physician, speak right, Connie, your physician will not only take that insurance, like I was saying, but be part of their network.
That's right, be
for
part
that.
of their network. One of the new preventive services that people who use Medicare have an opportunity to take advantage of this year it's a very interesting one. It's called behavioral therapy for cardiovascular disease. What does that sound like? Well, what that is about encouraging people to use lifestyle choices to help reduce their cardiovascular disease risk factors. So, for instance, behavioral counseling to help promote healthy diet, or exercise routine, or maybe just monitoring and screening for high blood pressure, things like that lower cardiovascular risk. And that's a screening that a person would have with their primary care provider.
Very interesting. Well, I know there's going to be all kinds of questions out there because we just touched the tip of the iceberg. There is so much information. There's presentations going to be. Is this going to be in the newspaper if people look in the paper to see?
I hope so. I really hope so. You know, we don't have very much money to pay for advertising. We are funded through mostly through a grant from the Center for Medicare and Medicaid Services. So we really take our advertising opportunities very seriously. We do also put out public service announcements to the newspapers, but it's always really up to them on whether they run them or not. People can call our office for sure at that 800-247-4422 phone number to check and see as well where there might be general information sessions being held. You'll also see quite a few presentations being delivered in the community by insurance companies. And we don't discourage people from attending those, but what we do want people to do when they attend those insurance presentations is make sure before they sign up with any insurance company that they really are checking out how it's going to affect them with their particular healthcare provider, and also make sure that they're considering all their options. There's quite a few rules in place around how insurance companies can advertise and market to Medicare beneficiaries, and those rules are there for protection. If you remember 5 or 6 or 7 years ago or so, where you saw a lot of steak dinners, and so a lot of people bought insurance based on a steak dinner, and ended up in a situation later on while they were hospitalized thinking that they had more insurance than they did, and not really taking the time to understand all the implications. And sales presentations at that time didn't really discuss all the implications of policies. Those rules have tightened down quite a bit, and you'll see people following much more strict formats of how they deliver that information. And that's there; those rules are there to help protect people. But it's also up to people to remember to be good shoppers. We really want people to be the very best consumer shoppers they can, because they're putting a lot of their money on the line. They might also start having trouble receiving health care services they need if they don't have the resources available, or they haven't planned for the resources they're going to need to have those health care services. And then there's also a lot of tax dollars on the line. We talk about Medicare costs as being very huge part of our budget, and it's true. Medicare spends about $1.1 billion, that's billion with a B, dollars every single day.
Wow.
About 10% of that can be attributed to fraud, waste, or abuse. So we really want people to be the very best consumers they can, do the very best job they can to shop for the very best insurance for them.
Well, when you get that Medicare and You book, look on the back. The SHIBA number is on there for your local SHIBA or state insurance provider services. Call them, get the information, go to one of the presentations that it's going to be local, get online, check your medications, see if they're covered and how much. Now is the time to do it. You've got until
Pearl Harbor Day.
Pearl Harbor Day.
Don't get caught on Pearl Harbor Day.
So pay attention. And again, if you have any questions, you can call the local state insurance office, which is the 1-800-247-4422, and they can help you. Again, this is Connie Clark with Home Helpers, and I've had Heather Tabor here with the Department of Insurance. You all have a wonderful rest of your weekend. Good day.